IVPOCUS stands for the International Veterinary Point-of-Care Ultrasound Society. We're a nonprofit formed 2 years ago, and our mission is to advocate the responsible use of point-of-care ultrasound and fast ultrasound in veterinary medicine.
I use the ultrasound every day on every patient, so it has absolutely changed the way I practice because I didn't get that in veterinary school.
I think the most important thing about IVPOCUS is to get the information out there, show people, how passionate we are about it because how well it works. Because we can save so many more lives, we can make our days are so much easier because of it, because it's so much more practical.
I can take the ultrasound and I can say, well, let me just do a global fast and see if I can figure out what's going on with your pet. Many times it's been extremely helpful for me. In fact, sometimes that's the very first thing I go to is a global fast.
The way we make this really simple is we have made it a standardized format. A radiologist or a cardiologist, when they examine structures with ultrasound, they do it the same way every time. And we standardize the methodology, including how we hold the probe and how we maneuver the probe. And it's a pretty simple system.
I heard about it and I came, and it was really changing. It was another way of using ultrasound. It was a revelation.
Using the ultrasound allows me to obtain a diagnosis, especially in a life-threatening situation, much faster, which facilitates treatment for the patient and the ability to communicate with a client, especially one that's distraught, that we found the problem and we can help your pet.
Even when you don't think it's useful, you just put a probe on the animal and you see, most of the time, you see things you don't imagine they would be there. It helps get an accurate diagnosis.
It changes everything, the way I approach every patient, the way I think about every patient, what I tell the owners, what my plans are for the day.
We all believe it is a new core skill, and this really should be a daily event. It's part of your physical exam. And once veterinarians see how impactful it is for daily patient care and detecting conditions that they're otherwise missing without point of care and fast ultrasound, that it will really catch on.
Part of the veterinary oath is to prevent and relieve animal suffering and to advance medical knowledge. And it has a big impact on both the pet and the animal's owner, because animals are pretty much a member of the family. And so for me to tell them right off the bat with a procedure that takes maybe 15 minutes or so that I don't see any obvious issues, it just helps me feel better, sleep better. It helps me know that I've told that owner as much as possible about what may be going on with their pet.